Sodexo is a global services organisation. We operate in around 80 countries around the world. We employ over 350,000 people. And we operate services for people and organisations as diverse as large corporate organisations, governments, third sector organisations, and we deliver a huge range of services to those organisations. In healthcare specifically, we have a global business that delivers services to over 1,000 hospitals around the world, and in those hospitals we'll deliver services as diverse as decontamination and sterile services, some diagnostics, certainly patient catering, cleaning, portering, you name it. We deliver a whole gamut of non-clinical services to health authorities around the world. Sodexo is fundamentally committed to putting patients at the heart of everything we do. Nutrition is one of the most essential parts of patient care in an acute setting. So good food delivered well enables patients to recover more quickly. If patients can recover more quickly from whatever illness they've been through, then that's good for the patient because they leave hospital earlier, and it's good for the hospital too. So from an overall care perspective, feeding patients really well with food that they recognise, with food that is appropriate to them as a patient, as an individual, so it gives them some choice as well, is fundamental to what we do. What we do is work very closely with modern matrons and ward sisters to ensure that the service times that we have for food work for that ward. So various different sorts of wards have different sorts of requirements from a meal service point of view. We ensure that we offer a flexible service that delivers to patient need and at the same time matches the requirements of that ward operationally. So things like enabling patients to eat outside of those meal times where that's appropriate for that patient is really important to us. Decent food gets patients out of hospital quicker because they recover from their illness faster. Good food enables patients, encourages patients to eat well and to recover more quickly from whatever episode they're going through. As part of that, we find that choice is really important. So giving patients choice, some choice about the food that they eat, is actually, I think, a fundamental requirement for the NHS. So serving the needs of diverse populations in an acute or primary care setting is fundamental. That means addressing issues relating to culture, what do people eat at home, to religion, what religious preferences do individuals have, what allergies do we have to cope with, and wrapping all that up together means that the provision of food that people recognise, food that they eat at home, and food that is nutritionally appropriate for that individual is really important. To that extent, Sodexo is, I believe, the largest corporate employer of dietitians in the world. So having dietetically led food provision, providing appropriate food to individual patients rather than groups of patients, is really important. Our dietitians work very closely with their equivalents in the NHS. But it's about more than dietitians. It's about understanding operationally what happens on a ward and making sure that food service works alongside that ward. Really one of the things that is critical there is the integrity of the food that we're providing. We need to make sure that that food is provided in a safe way, that the food itself is manufactured and delivered to the highest possible standards, and indeed the standards we work to are actually much higher than those required by the Department of Health in any case. And finally, that the nutrition information that we provide both to clinical staff on wards and to patients themselves is fundamentally important to making sure patients have choice, but also have the opportunity to consume food that is appropriate for their condition. One of the key issues for the NHS is malnutrition. A significant percentage of patients enter hospital malnourished, and unfortunately a larger percentage leave malnourished. We can fundamentally address those issues within the NHS by providing patients with nutritionally dense food that, should their appetite be not quite what it normally would be, will deliver the right nutrition to them in the right way, enabling faster recovery. Sodexo has a subsidiary company called Tillery Valley Foods located in South Wales, which is the largest producer of delivered meals for the NHS in the country. Tillery Valley works very closely with certainly central government and with the Department of Health to ensure that the products it supplies to NHS trusts around the country are absolutely appropriate for the patient groups that we're feeding, and also play to the national agenda in terms of things like better hospital food, things like salt reduction, things like allergen control. All those sorts of initiatives are very closely monitored and delivered by Tillery Valley Foods. We use fresh ingredients from very carefully chosen suppliers. In using approved suppliers, we're then confident of quality, safety, and provenance of the ingredients we use. We avoid ready-prepared convenience products where at all possible. Our menus will include freshly prepared soups and sauces, fresh vegetables and potatoes, and a lot of home-style products so that patients recognise the food that they're seeing on the plate in front of them. One of our fundamental priorities is food safety. Every product we supply is cooked in tightly controlled conditions, overseen by a qualified technical director who uses the latest in microbiological and chemical analysis to ensure that each dish is exactly as described and conforms to the most stringent food safety protocols. In fact, the guidelines we work to are significantly more stringent than those recommended by the Department of Health. As a healthcare services provider, Sodexo sets extremely high standards, whether it's food, cleaning, or general facilities management, or indeed any of the other services we deliver. We've responded to the challenge of ensuring hospital hygiene is watertight. It is of course vital in the fight against healthcare-associated infections, but it's important in its own right as well. While in hospital, patients should have confidence that their surroundings are being managed in a professional and effective manner. At Sodexo, we have over 35 years' experience delivering food services for patients, residents, visitors, and staff within healthcare environments in the UK. And that covers not only the NHS, but private hospitals as well. We understand the significant changes that have taken place in people's approach to and understanding of food and its relationship to patient outcomes over that period of time. So delivering healthy nutrition, delivering it well, delivering it in an environment and in a way that patients understand is fundamentally important to us. And that's why year in, year out, most of our customers come back to us. As well as feeding patients and residents, we provide a range of food services for staff, visitors, etc., etc. But of course it doesn't end with food. At Sodexo, we design, manage and deliver a whole range of services for very demanding healthcare clients. In delivering those services, we protect the reputations of our clients and we work closely with them to ensure they operate within the regulatory frameworks imposed upon them.